Hey beautiful soul, if you are planning your hair transplantation and if you think hair transplantation is just a destination and you have to just reach out to somebody who can give you results and the results you are watching on internet and you think that now this guy can do justice to my case and I'm going there. Better watch this video, understand all the important points. You cannot miss this. You cannot afford to miss this. Okay, I'm your friend Dr. Shaiil Gupta, and with 20 years of experience, I am telling you certain things which are so important for you, and so keep watching. So now, as I've told, hair transplantation is a journey, not a destination. So even if you get it right once, you might be screwed with the chances of retention of your hair. Okay, so there are three resources which we as a surgeon generally use to sustain your existing hair and as well as to have hair on your head. One is medication, that means which includes finasteride, minoxidil, and many other medicines, biotin. Now, second is PRP, platelet-rich plasma, and the third resource is your donor in the form of hair transplantation. Now, as I've told, hair loss can be progressive. We all know that. There is no end point. It does not stop. You still may have a continuous thinning. So, what will happen after transplant? The existing hair may still thin out. The new hair, the transplanted hair, can acquire characteristics of recipient site and they can also thin out. So you need something to sustain them. Now you have three resources and you would like to use these three resources in the best possible way, keeping your interests in mind. Now it is like, let me give you an analogy. You have 1000 rupees with you and you want to um, in fact and you are stuck somewhere and you have to buy food for next 1 month from these 1000 rupees only. So these are not dollars, these are rupees. Okay, and you see an advertisement on internet of Pizza Hut, they are selling you a big deal, big meal, which is very tempting at 999 rupees. And in spite of everything, you just get tempted because you are seeing so many people eating it. You are seeing celebrities selling it. Okay, some cricketers, some actor, some singer is saying, "Oh, Pizza Hut's pizza is amazing. You must have it." Some foreigner, some telling you, "Okay, see, Pizza Hut pizza is amazing. You should must have it," and you buy it for 999 rupees. Now you are left with 29 days and just 1 rupee. What will you do? These Pizza Hut guys, they'll sell pizza, they'll run away, they'll make money out of you. Now you will die out of hunger because of over usage of your resources, unplanned resources, or planned from a person who really doesn't care about you. So, like if you are planning to build a building, you definitely need an architect who can lay the foundation, who can tell you how to go about it. So, that's how when you plan your hair restoration journey, you need guidance. Guidance from a person whom you can trust, who really cares for you. Okay? Not the Pizza Hut guys. Okay? Not the Pizza Hut guys. So, now if you talk about the medication. Now, more or less all the patients, they are given finasteride 1 mg per day immediately after transplant, minoxidil twice a day. They are given 5, 6, 7 PRP sessions, which is of no use because in fact it may induce tolerance in the body. Now, medicines also come with two problems. One is dependence. So if you start medicine, you cannot stop it. Okay, so starting is easy. Starting is easy for the doctor, and especially at 1 mg per day. Come on, studies clearly show that you can give this medicine at 0.2 mg doses also. It works, but it might not grow that many hair. You know what is the biggest lie in hair transplant industry? I have done a transplant. Now I am giving you finasteride to save your existing hair. I have done a transplant. That's a wonderful transplant, but now I'm giving you the medicine not because of transplanted. That's done, that's my work. Come on, but I'm giving you finasteride because I want to sustain your hair. No, I've made tons of video. Go and watch what finasteride can do. It is not actually just sustaining your hair. It is actually making your existing hair thicker. It is working on all the three aspects of hair transplantation which you are comparing. Sometimes people tell me, doctor, your density is not that great. That clinic is giving me wonderful density. Your hairline is not that great. That XYZ clinic is giving a beautiful hairline, impeccable hairline. So I have made already enough videos. Go see these results. These are all finasteride without transplant. Okay, not a single hair has been done, but just imagine what medicine can do. Now, another problem with the medicine, obviously side effects. Another problem which is tolerance. Even if you don't get a side effect because of medicine, you may develop tolerance to the medicine. And after one point of time, it will stop working on your head. And if you stop, you have severe rebound. If you don't stop, still you are losing hair, and the doctor and you yourself cannot do anything. You are stuck. So as soon as you start the medicines, the reverse meter also starts. So I have patients where I started this medicine after 6-7 years of transplant, and it is still doing great. I mean, similarly, now coming to donor, it is just common sense. There is no rocket science in it. That if you want to make full use of donor, which you might need to because hair loss can be progressive, but just because your surgeon does not know how to do FUT, you are in a fix, you are stuck, and you hear all the stories about FUT and all the myths. I've broken those myths. I've told many times about the importance of safe donor area, importance of complete utilization of donor area. These cases, you can see, they come to me for repair. They are almost gone donors, nothing can be done, but still FUT can come to their rescue. As a doctor, as a mentor of your journey, it is my responsibility to ensure that whatever possible methods are there, I must practice and master them, you know, and then make the full use of these techniques for your benefit. Otherwise, if somebody does not care for you, they won't do this. They will just tell, okay, this is good technique, this is bad, we don't do this, and all that, shitty stuff. Please don't believe. Please don't believe. Make use of your brain. God has given you this brain. Make full use of it. Use your common sense. Come on. That's so rare these days. These are all thought-provoking videos. If you are watching my video for the first time, consider yourself lucky because this will save you from a lot of trouble. And we do a lot of repair cases where patients have already undergone transplants in bad shape, all the donor gone. Now it is not just about donor. See, all these patients are put on finasteride. They are at the peak of the tolerance. Now further, continuation of this medicine, finasteride, is not going to help them anymore. In fact, the graph starts going down because already the medicine was started at 1 mg per day dosage, which actually leads to patient developing tolerance. Just look at the cases. This medicine. There are clinics which you must be knowing that operating for. I myself have been operating for almost 20 years now. There are so many others, good doctors doing surgeries for more than 10 years, and they have been giving their patients finasteride for almost more than 10 years. Ask them, see the number of cases who are actually taking finasteride for that many years. See, go and see if they are able to sustain the results or there is severe thinning. You will see a lot of influencers and people like who got their transplants done. Now they are guiding you for transplants and all that stuff, getting second or third surgeries done. uh, if you really think that they were not using any medication because it's their business, they will use the medicine at any cost. come what may. But now, in spite of continuously using the medicine, um, the hair can fall because of tolerance, and then that's a big problem. But nobody will tell you. So I think you need to consult somebody who cares for you, thinks for you, and for whom only you matter, nothing else. Okay, so I know if I am giving a result to someone without the help of finasteride, and I add finasteride into it, it will make the result look 2, 3, 4 times dense. See, use your brain, come on. When you are watching results, see, the transplant is done only in a small area, rest of the area is not done, but when you see the post pictures, everything is covered. Where the hell these hair are coming from? Why don't you think about this? Please. So, you need to consult a doctor, a mentor actually, who can see through, who can help you to see through this journey. Okay, so you can consult me also, but I am a busy man, busy surgeon, not a lot of time, but just because I love you guys and I uh, want to make people understand the basic facts, and so that they should not get cheated. Okay, so when you see results and when they are so much modified or boosted by the medicine, and you think that this is a great work, this might be just a very very ordinary work, and then these people come and cry in front of me. So uh, it is not easy for me to give individual consultations to each one of you. You can consult me on Zoom webinar. You can book your consultation, contact my team, given numbers. I will try to connect with as many as possible. Thank you. Love yourself. Happy hair.